How are vaccines adapted for immunocompromised lupus patients? Vaccines are carefully designed to protect everyone from preventable diseases, but for people with lupus who have weakened immune systems, vaccines are often adapted to ensure safety and effectiveness. Since lupus is an autoimmune disease that can affect immune responses, healthcare providers follow specific guidelines to tailor vaccination plans for these patients. The goal is to provide protection without increasing the risk of disease or triggering a lupus flare. In general, live vaccines, which contain weakened versions of viruses or bacteria, are usually avoided in people with lupus who are immunocompromised. This is because their immune systems might not be strong enough to handle even the weakened pathogens, which could cause illness. Instead, healthcare providers recommend inactivated vaccines, which contain killed pathogens or parts of pathogens. These vaccines are safe for immunocompromised individuals and can still stimulate the immune system to build protection. For lupus patients, vaccination timing is important. Doctors often recommend administering vaccines when the disease is well controlled and the patient is on the lowest effective dose of immunosuppressive medications. This helps maximize the immune response to the vaccine and reduces the risk of adverse effects. For example, if a patient is on high doses of corticosteroids or other immunosuppressants, healthcare providers might delay certain vaccines until medication doses are lowered or the disease is better managed. In some cases, additional doses or booster shots are recommended to improve immunity, especially if the patient's immune response may be weaker. For instance, the pneumococcal and influenza vaccines are commonly advised for lupus patients, as they are at higher risk of infections. The influenza vaccine is given annually, and the pneumococcal vaccine is given in a series of doses, depending on age and health status. Monitoring the patient's response to vaccines is also key. Blood tests can sometimes assess whether the vaccine has elicited an adequate immune response. If the response is insufficient, healthcare providers may consider additional doses or other protective measures. It's important for lupus patients to discuss their vaccination plan with their healthcare team. They can provide personalized advice based on the patient's disease activity, medications, and overall health. Following established guidelines from reputable health authorities ensures that vaccinations are both safe and effective. In summary, vaccines for immunocompromised lupus patients are adapted by avoiding live vaccines, timing vaccination during periods of disease stability, possibly administering additional doses, and closely monitoring immune responses. Always consult with your healthcare provider to develop a vaccination plan tailored to your specific needs. Proper vaccination can help protect lupus patients from serious infections while keeping their health and safety a top priority.